Good evening, everyone. Welcome to my one day masterclass on mindfulness based stress reduction. So, this is me. I am Ria Khurania. I am the founder and the therapist at the Psychicc Mantraa. Also, I have completed my master's in counseling and family therapy, and I am passionate about helping the people. And I basically work with the different age groups like the children, adolescents, adult, couple, family, geriatric clients, LGBTQ clients, and in the group therapy. Also, I am a career coach, NLP master practitioner, mental health coach, and expert in psychological first aid, women empowerment coach, and a parent coach. So, this is all about me. I have an experience of more than 3 years in this field. So, I welcome you all to my one day masterclass, and I hope that you will learn from this workshop and this will be helpful for you. So, before we start or move further, can you just can we have a quick introduction? Can you tell me your name, from where you are joining, and what exactly do you do? Just a quick intro. You can either write it in the chat box or just open your mic and speak. Yes, Alka ma'am.
Good evening, ma'am. My name is Alka Vijay, and I'm from Kerala. I completed my master's in psychology from Devagiri College in Kerala itself, and currently I'm working as a psychologist.
Thank you so much, ma'am, for the introduction, and ma'am, welcome back after so much time in the workshops. Now, the Dhruvi ma'am.
Hello everyone, I'm Dhruvi Shah from Ahmedabad. I have completed my graduation in psychology and right now I have started my own setup for the holistic wellness where I provide sound healing art therapy as I am the international sound healer and art therapist as well.
Oh, thank you so much, ma'am, for the beautiful introduction. Anyone else who want to introduce themselves?
Yes.
Yes,
Hi,
Rajesh.
good evening all. Yeah, yeah.
Hello, everyone.
Um, yeah. I I completed my master's in clinical psychology last year, and I'm working as a wellness officer in Merchant Navy Institute in Pune.
Oh, that's amazing. Okay. So, anyone else? Okay. Then, without wasting our time, we can move to the next slide. That what exactly we are going to explore today. So, today we will not just only learn about the mindfulness based stress reduction, but also practice it all together. So, here is the flow of the session. So, today is we will learn that what is MBSR. Second, the origin and the core principle. Third, the science and the therapeutic foundation. Next, the therapist role in the MBSR. Next is the MBSR session structure and MBSR versus the other psychotherapies. Also, MBSR versus the general mindfulness practice. That how the MBSR, that is mindfulness based stress reduction, it is different from the other mindfulness techniques or normal mindfulness. Also, we will learn few practical techniques that you will learn from this workshop, and then we will have a proper case discussion. So, moving forward, first thing first, that what is MBSR? So, anyone who has learnt about this, know anything about this, or this is the first time when you are hearing this? Is it a new thing or is it something that you already know?
It is something that we already have studied
Hmm.
or we already know bit of that.
Hmm. Perfect. Anyone for whom this is a completely new topic? Okay, I think everyone know a little bit about the MBSR. Yes, yes. So anyone who want to give it a try, that what it is, what you have known about this?
It's a practice which help in reduction of stress, which is majorly used in corporate world
Hmm.
to deal with the corporate stress and the work-life balance, where
Yes.
we give them guided techniques and everything to reduce their stress and maintain their good quality of work and everything.
Perfect. So this is what MBSR is. Yes. Combat Zim is the founder. So MBSR, or the mindfulness based stress reduction, it is a proper plan which is created by the Dr. John Kabat Zinn to help us to become more aware of the present moment in a kind and in a open way, so that we can understand that what is the power of the mindfulness, how to be in the present moment, how to stay focused in the present moment in the kind and a open way. Kind and a open way means so that we can not pressurize ourselves. It's like very easy going to us. So it's like the training your mind to be calm observer, imagining the watching the cloud float by without chasing or pushing them away. It's like becoming the calm observer. You are in the indulged in the moment. It could be like the stargazing, in which we just look at the stars, or we just look at the clouds that are floating or chasing or pushing them away. Okay, so this is a skill that help us to notice the stress without getting caught up in it. So in this we notice the stress, that okay, what is the stress, how it is impacting us, without caught in it. It's like without not getting in the negative spiral loops of the negative impacts of that stress in our body. Okay, like for example, that if you are stuck in a traffic and feel frustration rising, at that point MBSR teaches you to notice that feeling without judging yourself for it. Instead of reacting, you become more aware, which can reduce that stress surge. So it's like if you are stuck in a traffic and you are feeling very frustrating, you don't know what to do at that point, the stress levels in your body is increasing at a very high level. So at that point this MBSR help you, or it will teach you to notice your body, to notice your feeling, to notice your thoughts and each and everything, so that without any judgment. It's not like that I am criticizing myself for that thing, I am just being hard on myself. So I will just notice that okay, what are the things that is going in my body, and then instead of reacting, I am more aware, and I know that how to reduce that stress urge. It's like if I know that okay, I am allergic to peanuts, at that point in the next time whenever I will have any food, I will first ask, okay, this food has the peanut or not. If yes, then I will try to avoid that. I will become more about my own self. So this is the same thing that happens in the MBSR, in which we be in the present moment, we understand ourselves, we understand our surrounding, we understand our body, and then we will select the ways that how we will react, or how we will respond in that situation. So this present moment, or the non-judgmental awareness, is the heart of the MBSR and the first step towards managing the stress more effectively. So this is the first step in the MBSR, in which we be in the present moment without with a non-judgmental awareness, that we understand ourselves without judging ourselves in any way. So this is the first step towards it. Next is the origin and the core principle. So MBSR combined the ancient wisdom from the Buddhist tradition with the modern psychology and the neuroscience. So MBSR contains, or it combines the Buddhist psychology or the Buddhist tradition with the modern psychology and the neuroscience. That's how MBSR is being founded. So its roots help us to understand that how to connect the mind and the body. So basically its roots, yeah, because like from the all of these things we can understand that it help us to understand that how we can connect our mind with our body and live a more holistic wellness life. Next is the key principle, that what are the key principle that is included in the MBSR. First is the non-judgmental. It's like watching a river flow without trying to change it. It's like we are just watching it out, we are just observing it without giving any judgment, without try to change it out. It's like just watching the river, it's like how it is flowing, to be in that moment. Okay, so this is the non-judgment thing that we earn, or that we learn in the MBSR. Second is the acceptance, that is meeting the reality just as it is, like feeling the wind without fighting it. It's like accepting the reality, understanding it, and it's like feeling the wind without fighting it. It's like we are understanding, we are feeling it, we are not fighting to it. Okay, we are not like that, oh, I don't want this air, I have to change it out, I have to protect myself. No, we are accepting it, we are accepting our triggers, we are accepting ourselves, that that okay, we might have all of these things, we have all of these triggers, and now I have to accept myself. Okay, this is the second thing that we learn in the MBSR. Third is the present moment awareness. It means that being here now, not lost in the past records or the future worry. It's like being in the present. It's like if I am teaching you, if I am telling you something, so your whole focus, your all the five senses are included in this. Okay, it's not like that you are thinking about your past, thinking about your future, or anything like this. So this is the present moment awareness. It's like just be in that moment. You are not thinking about what happens in the past, why they do this thing, why this happens to me, anything like that, and even about the future. It's like you are just in the present. Okay, so this is the present moment awareness, which is a key principle in the mindfulness based stress reduction. Next is the mind body connection. It means understanding that what happens in our mind affects our body and the vice versa. It's like if anything physically happens to you, it will impacts your mind, and also if anything happens to your mind, or if there is any mental health issue to you, then automatically you will feel the physical pain. Like for example, when you are when you have a lot of the overthinking, when you have a lot of the worries, at that point we got the headache. So this is like a mind body connection, that both are interlinked to each other. And also for some client, when they have the mental health issues like the anxiety, the depression, or anything like this, if we talk to them and discuss these things, that can you feel, where can you feel this emotion, so sometimes they may say that I feel a pain in my chest, in my stomach. It means that they are being nervous. It means these are the places where their emotion are being stored. Okay, so this is the mind body connection, which is also a key principle in the mindfulness based stress reduction. Like for example, think of a phone battery. When stressed thought drain us, mindfulness act like a power saving mode to help us recharge us. Okay, so you can think your life, or you can think everything like a phone battery, that if stress is something that is draining you out, if stress is something that is making the thing more complicated to you, so at that point mindfulness act as a power saving mode that recharge us to be in the present moment, that recharge us or give us the energy to fight from all of these things and lead toward the calm and the peacer life. Okay, so it's like a resilience thing, it's like a coping skills that can help us in all of the domains. Okay, so clear till now, or am I going too fast? Just give me a thumbs up.
If you could go slow, it will really help.
Definitely, ma'am.
Thank you.
Until then, is everything is clear, or do I have to repeat anything?
It's clear, ma'am.
Okay. Okay, next is the science and the therapeutic foundation. That what is the science and the therapeutic foundation behind the mindfulness based stress reduction? So research has shown that the mindful practice literally rewire the brain, strengthening the area for the focus and the emotional control, and even calm us out. Okay, so they helps to reduce the stress hormone and improve the feeling of the well-being. So in the research it is being shown that the mindful practice means including all the five senses in the present moment. Like for example, the mindful practice could be that having a proper moment in the nature, having a moment with your dog, or eating your food all alone with having all your focus on that thing. Okay, so these are the small mindfulness habits. Even if doing the yoga, going to the gym, and even sitting in the nature, meditation, breathing techniques, these all are the small mindfulness practices that we do in our day to day life, and even we as a therapist recommend our client, because these practice literally rewire the brain. Okay, many clients cannot feel the positive emotion, they felt like that internally I am completely hollow. So at that point, mindfulness practices strengthen their focus and their emotional control. It's like also this is, that's why this is also a core part of the DBT, in which we told them to control their emotion. That's why the mindfulness practice is used widely in approximately all of the therapy sessions, because it will calm you down, help you to control your emotion, and make you internally strong and more focused in the present thing. Okay, and also if you have a lot of the spiral thoughts, negative thoughts, overthinking thoughts, when your mind is completely blocked, so at that time grounding techniques or the mindfulness practices help you out to reduce that thing in your, reduce the hormonal level, to reduce that stress hormone in your body and gain the control of your body at that moment. Okay, so people with the anxiety or the chronic pain often find relief through the MBSR because it trains the brain to respond differently to the difficult sensation or the thoughts. So when the client have the anxiety, the chronic pain, even if in the case of the depression, even in the case of the OCD, any conduct disorder, anything like that, at that point MBSR is being used because it will train the brain. In this we are training the brain that how to respond differently, differently in the difficult sensation or the thoughts. It's like when you have a lot of the anxiety, okay, when you have a lot of the negative thoughts in your mind, at that point how to respond it out, how to observe yourself, how to calm yourself down, how to be in the present moment. So this is what we do in the MBSR. So think of the mindfulness as a workout of your brain's calm muscle. Just like exercising helps your body, mindfulness exercise your ability to stay present and regulate your emotion. So this is what the mindfulness do. It will make sure that you will be in the present and regulate your emotion. And even if you are a therapist, from the first session you can even recommend the mindfulness to a lot of your clients, because this can help them out to improve a lot of things from the internal level. Like for example, as I told you that few clients cannot feel the positive emotions, they cannot control their emotions, they have a lot of the negative thought. So at that point, if you try the mindfulness practices with them, if you use this mindfulness based stress reduction on them, so this will help them to calm their brain muscle and gain more insight about their own self. So this can be used for the self awareness, this could be used for the emotional regulation, this could be used for the observation skills, this could be used if your client has the issue in their mind body connection, and if their food habits and sleep habits are not good. So at that point, if they are extremely stressed because of anything, so you can use this in their day to day life practice or even incorporate this in your practice. Next is the therapist role in the MBSR. That what is the role of a therapist in the mindfulness based stress reduction? So research has shows that the mindfulness practice rewire the brain, strengthening the focus. Just a second. Yes, so research has shown that the mindfulness practice literally rewires the brain and strengthen the area for focus, the emotional control and the calm. So this will help to reduce the stress hormone and improves the feeling of the well-being. So people with the anxiety or the chronic pain often find relief through the MBSR because it trains the brain how to respond differently to the difficult sensation or the thoughts. It's like this. Okay, so in this the therapist main role is to create that environment so that they can feel all of these things. Okay, they have to be non-judgmental, they have to create that area to them. Sometime when the client feel it very difficult to rewire their brain, to strengthen their focus, to meditate, or to just have a present moment kind of thing. So at that point it is the role of the therapist to guide your client, to help them out in the each and the every stage, and giving them that safe and the comfortable environment so that they can talk about it, they can observe themselves. If they feel like that this is something that I cannot do, then as a therapist you can give that comfort to them, you can empower them that yes, you can do this thing, you can add the little bit activities or the small steps so that they can observe it in the more impactful manner. Because the main thing that we as a therapist have to do, we have to create that holistic wellness thing to the client so that they will feel more comfortable and more empowered by this. Now the therapist consideration and the contradiction. So while MBSR benefits many, it's important to assess the client readiness. Also we have to check that whether our client is ready or not. Okay, so People with the acute trauma or the severe dissociation or even with the psychosis might need adapted mindfulness practice or the alternative support. Like if your client have the acute trauma could be from the childhood, from the current trigger, from the grief or loss or anything like that. If they have the severe dissociation or the psychosis, at that point you need to adapt the mindfulness practice, and even you can incorporate the alternative supports that the client required. Okay, so that's why you need to check the client's readiness, that whether they are ready for it or not. Second is the facilitator encourage a beginner's mind, emphasizing the curiosity and the judgment and the non-judgment. It's like if you facilitators can encourage this beginner's mind, because when they are doing something for the first time, so at that time they might be confused, they might be curious, they have a lot of questions. So at that point the therapist should be non-judgmental. They have to answer all of these things, they have to psychoeducate their clients, and also if they have any doubts, any fear, then as a therapist you have to psychoeducate them so that they can move forward with those things. Next is the sensitivity to the participant distress during the meditation is crucial. Some may experience the emotional discomfort. So it's like in many of the cases when we do the meditations, when we uses these kind of the techniques on them, so they all of the sudden they started to cry. Okay, they cannot feel anything, they feel very distant, and this is something and even if they feel very distressed, sometimes they might feel that okay, I cannot do this, or this is very heavy for me. So at that time they may feel like emotional discomfort. So at that point you have to consider this, and you have to make sure, and as a therapist you have to ready your relapse plan, that okay, if this happens then what we can do with this. For example, a participant experiencing the flashback during the body scan might be guided to a shortened practice time. Use the grounding techniques or try the gentle mindfulness movement instead. Like during the body scan, in which we scan the body from the head to the toe, when we are doing these kind of the things, so at that point you can shorten that practice time. That if you know that it might trigger the client, or it is triggering the client during the meditation, then you can just shorten your meditation, and also incorporate the grounding techniques. Like for example 5 4 3 2 1 you can incorporate. Even if you can incorporate the normal breathing techniques, like breathe normal breathing technique, or like box breathing, or any other breathing techniques, this is how they will try gentle the mindful also you can try the gentle mindfulness movements. It's like just patting yourself, hugging yourself, and even if you want you can ask them to just stand and shake their hands, anything like this, so that they will feel more confidence. And if they have this emotional discomfort, this can also be reduced. Next, therapist support help the participants to maintain the safety and keep the engagement strong as they explore the mindfulness. So therapists support the participant, okay, maintain the safety, that the client feels safe, they feel comfortable, and they feel engaged and strong as they explore through the mindfulness, because there are a lot of things that will come out only in the meditation, or only through this thing. Next is the mindfulness MBSR, that is compared to the general mindfulness practice, that how it is different from the general mindfulness practice. Until now everything is clear, or am I going too fast? Okay, so now MBSR compared to the general mindfulness practice, that how it is different from the normal mindfulness. Like in the mindfulness we have learned about the mindfulness based cognitive therapy, mindfulness based art therapy, and a lot more. So how MBSR is different from that? So mindfulness in everyday life mean paying the attention to the present moment in whatever you are doing, whether you are eating, walking, even washing the dishes. So mindfulness simply means paying attention to your day to day life schedule, to be in the present moment. Okay, so this informal mindfulness often happens spontaneously, like noticing the warmth of your coffee or the sound of the bird. So this kind of the informal mindfulness, this happens in the day to day life, not in a particular format, but it can happen anytime. Like if you are drinking a coffee, then you can have a proper mindfulness moment. If you are just watching a movie, at that point it could be your mindfulness moment. If you are looking at the sky, the stars, it could be your mindfulness moment. So it could be anything that will make you more aware and make you in the present moment. Okay, so that is the normal mindfulness. Next, MBSR takes this daily mindfulness step a further. In mind MBSR, we take it to the next step. So it is a proper structured 8-week program with a weekly group sessions, formal guided practices like the body scans and the mindful moment. Everything is included in the MBSR, which is a proper structure plan that okay, in the week 1 you will do this, in the week 2 you will do this, and the proper home assignments. It's like if we are doing the body scan meditations in the session, that at the home there is a particular home assignments that you have to do. Okay, if you are a client, then you have to do, you have to work like that. So it's a proper structured program, okay, which will develop the deeper skills systematically. Okay, it's like if I'm creating that mindfulness skills in you, then by doing the homeworks, by using this thing, this will deeper the skills in the systematic manner. Like for example, if someone might casually take 3 deep breaths before a stressful phone call, this is a general mindfulness. But in MBSR, they will learn the specific breathing techniques, practice daily, supporting the focus calm even during the anxiety or the pain. It's like if you are on a call, if something is very stressful to you, at that point just taking the normal deep breaths or the 3 deep breaths, this is like a general mindfulness. It's like you are doing it in the moment to be in the present thing. But in the MBSR, we learn the specific breathing technique, like for example box breathing, starfish breathing, balloon breathing, or anything like that. We have to do this, we have to practice it daily, which will support the focused calm during the anxiety or even in the pain. So think of the general mindfulness like the casually watering the plants, while MBSR is a well planned gardening course with the tools and the guidance to make the garden more thrive. So both build the awareness and the presence, but MBSR help to cultivate the mindfulness under the stress and across the life challenges. So this is why MBSR is different from the general mindfulness practice. Is it clear? Okay. So now next thing, that how MBSR and compared to the other psychotherapies, that how MBSR is different and similar with the other psychotherapies. So let's look closely at how mindfulness based stress reduction compare with the various psychotherapies, which each focus on how they work, how MBSR is different, plus an example, and how combining them can boost the therapy. So we will learn that how it is different with an example, and also if we combine the MBSR with this psychotherapy, how it can impact the more in the in the therapy sessions. So first with the CBT. So what does CBT does? So it helps you to identify and challenge the negative thinking pattern, like I am not good enough, and replace them with the healthier thoughts. It's like being a detective for your thoughts. So basically cognitive behavior therapy works on our thoughts and our behavior, in which we identify and challenge those behavior or the thinking patterns that are not serving to us, and we replace them with the healthier ones. Okay, like in this I am not good enough, we can replace it to I am trying my best, I am the best, or anything like this. Okay, so what is MBSR does? Now what MBSR does is that instead of changing the thoughts, MBSR teaches you to observe the thoughts and the feeling without the judgment, like watching the cloud pass in the sky. So in MBSR, we are not challenging the thoughts, we are not try to just create a judgment around it, we just simply observe them, that okay, what are the thoughts, what are the feelings, what are the things that I can feel in my body, I can imagine in my body. So in MBSR we do like this. So now for example, that before a job interview, CBT might encourage you to replace that I am a fail with I am well prepared. So with if you are using the CBT, you will work on this negative thinking pattern, that I am a failure, I will fail, you will replace it with the I have prepared well. So this is what we do in the CBT, in which we have used the cognitive restructuring. But MBSR would have a notice the nervousness in the body. If we are using MBSR, it will observe the nervousness, that yes, we are nervous because of the interview. Okay, so now breathe into it and accept it without trying to change it. We will accept it, we will say that yes, we are nervous, and that's why my mind is working like this. In this, we are not just try to avoid the thing, we are accepting the things, that yes, we are feeling this. Because in a lot of clients, this is the same thing that happens. If you use the CBT, at that point you try to ask them, okay, now what are the alternate thoughts in this situation, or for this thought they felt that okay, these are the alternative thoughts, but I cannot internalize it. Okay, this is something I am faking it out. Okay, so many clients feel like this. So at that point, we are not challenging in the MBSR, we are just accepting it, that okay, I have this issue and I accept it. Okay, now if we combine both of these therapy, how it will impact, like combining both help the client to recognize the negative thought and also develop a calm awareness of their bodily sensation and the emotion, leading to less overall stress. It's like, just like for example, in this situation where I am feeling nervous, and because of the nervousness I have this thought. If I have this awareness about myself, that I am nervous, that's why I am having these negative thoughts, but I have already prepared. If it's like a complete plan for the it's a complete plan from for the client, in which we are creating that awareness, we are creating the awareness related to the emotions, the feelings and the thought, and that's why leading to the overall less stress situation. It's like, now I accept that thing, now I understand that thing, and now I can respond it in a perfect manner without just try to being hard on myself. So this is what the difference in between the CBT and MBSR, and how if both are combined can impact greatly. Next is the DBT, that is the dialectic behavior therapy. So what DBT does, so it combines the it combines the CBT strategies with the mindfulness and the acceptance, teaching the skills to handle the intense emotion. Like in the dialectic behavior therapy, we basically work on the emotional dysregulation. Okay, the client who have the extreme emotional dysregulation, that's why it is used with the client having the borderline personality disorders. So in this, we combine these strategies with the mindfulness and the acceptance, and teaching these skills to handle the intense emotion. It's like how they can handle that intense emotion by using the simple things. Okay, but in MBSR, it offers the mindfulness practice that focus purely on the observing and the acceptance. So in this, we focus on the acceptance, we focus on the observing, we are focusing on observing the things, understanding the things, accepting the things on the all levels, like on the thoughts level, on the feeling level, on the physical level, on the mind body level, so that we can understand it in a proper manner. Like for example, if someone feeling overwhelmed by the anger might use the DBT to both challenge the thought that I can't control this, and practice the mindfulness breathing to stay in the present. Okay, so this is the example in which, if a client feeling overwhelmed by the anger, if they are very volatile at the anger, so they can use DBT to both challenge the thought that okay, I have to challenge it, and also they can practice the mindfulness. It's like they can practice the mindfulness to stay in the present. So if we combine both of these things, that DBT with the MBSR, using the both allow the client to change the unhealthy emotion while staying grounding and accepting themselves, which can deepen the emotional resilience. It's like, if this is happening, if we are combining both of these things, so we will help the client to change the unhealthy emotion. It's like changing those emotion while staying grounded. It's like replacing the anger with a positive manner. We are making them more aware that how to respond in that manner, and even being grounded and accepting themselves, which can deepen the emotional resilience resilience. This can create that coping mechanism in them, so that they can lead towards a more holistic wellness life. Next is the emotion focused therapy. Clear till now? Any doubts? Okay, so now the EFT, that is the emotion focused therapy. So what EFT does, it guide the client to recognize, accept and express their emotion, like turning into a musical instrument. It's like we are accepting, we are recognizing and expressing the emotions, that what we are feeling at that moment, or what is the core feeling that we have. Like for example, if someone hurt us, or at that point we feel very sad, but we are unable to say them anything. So sadness is the primary emotion that we hold, and because of this sadness, if in the future if anything is triggering to us, at that point we try to fight to them, we try to avoid them, we become feared because of the sadness that we hold. So in EFT we recognize that what is the primary emotion, what is the core emotion, what are the core needs that are behind all of these things, or behind all of the behavior, all of the thoughts that we have. Okay, so EFT works with that. So now what MBSR does, so it helps in noticing the feeling without immediate reaction, cultivate the patience and the acceptance. It's like understanding, and it will help to notice the feeling and cultivate the patience and the acceptance in the client, so that the things that are impacting on the surface level can also be calmed down. Like for example, a person feeling sadness after a breakup might be encouraged by the EFT to deeply feel and express the sadness, while MBSR teaches them to observe that sadness gently, notice where they feel it in the body without the judgment. Okay, so it's like what they are feeling, how they are feeling and where they are feeling. This is what we can do in the MBSR. Next is the impact, that if we combine both of them, that what will happen. So combining these can help the client to fully experience and process the feeling while maintaining the calm awareness, leading to the emotional clarity and the peace. It's like if we combine them both, so combining them both can be a fully experience. It's like processing the emotion, understanding them, maintaining them calm awareness and accepting the emotion, that can lead towards the emotional clarity and the peace in the client's life. So next thing is the somatic therapy. Okay, so what does it means, what does it does, so it focus on releasing the tension stored in the body through the movement and the awareness. So somatic awareness, it's when we feel the tensions in our body. So with the somatic therapy, with some movement and with the awareness, we are able to release that tension that are stored in the body. Like in the PMRT, that is the progressive muscle relaxation technique, or someone known it as the Jacobson muscle relaxation technique. In this also we try to focus on the different muscle parts, and from that we try to release the tension from the body. So you can understand this, that this is also a type of a somatic activity. Okay, so now what MBSR does, so it teaches the noticing the body sensation in a gentle and a non-judgmental way. It's like again we are understanding our body, the sensation, where we can feel it, each and everything like that. So example, that if someone notice the tight shoulder during the stress, the somatic therapy might involve the gentle movement or the breathing exercises targeted at the relaxing that tension. So it's like if you can feel that thing in your body, like in your head, in your chest, in your shoulders, in your stomach, in your thighs, or in your any body part. So with the mindfulness based stress reduction, you can observe that thing, you can find that target places, and with the somatic therapy you can release that tension from your body. If you combine them both, so yes, this is how the client will learn both to recognize the tension and actively release it, improving the physical and the emotional health. Okay, so this is how it is. You can combine it with the somatic therapy. Next is the solution focused brief therapy. So what does it does? So basically it focus on the solution and the future goal instead of the dwelling on the problem. So in solution focused brief therapy, it is a short term therapy that basically focus on the solution. Like, if for example, if I have an exam tomorrow, then instead of thinking of my past exam result, instead of thinking of my past achievements and everything like that, now I will find a solution. Now, like, what I can do, what are the plans that I can do that will help me to resolve this problem and reach towards my future goal. Okay, instead of dwelling on the problem, instead of just thinking that why this problem happens to me, why this happens to me, everyone having a good life, why don't I have like this? Instead of dwelling like this, and now I have to find the solution for my problems. Now I have to focus on my future goals. Like, if everything happens, it's okay. Now what I can do in the next thing. So this is what we do in the solution focused brief therapy. So now what MBSR does, so it cultivates the present moment awareness that helps the client to recognize what works. It's like, right now, if I have to focus in the present, if I have to focus for my future, if I have to focus on the solution, so at that time I have to be in the present moment, I have to be in my senses, I have to accept each and everything, I have to understand my body. This is what we do in the MBSR. Now example, that a client may want to reduce the workplace stress. So solution focused brief therapy helps to identify the small achievable steps. Like, if I want to reduce the workplace stress, then how the SFBT, in SFBT we will try to add small steps. Like, by the next week I will have one dinner or anything like this, that will help me to reduce the stress and help in the small steps I can achieve that thing that will help me to reduce the stress. While MBSR enhance this by helping them notice the stress trigger directly through the mindfulness and respond in the more calmly way. It's like, with the MBSR it will help me to notice the stress triggers, that what are the triggers, what are the things that is impacting me, and then I can through the mindfulness, and then I'm be like more prepared to respond more calmly towards it. It's like, in the workplace stress, I have the stress related to my presentation. So in the SFPT we will try to divide that thing into the smaller steps. Like, in next 2 days I will do the research for my presentation, and then in the next 2 days I will try to prepare the proper presentation. So this is like the small steps, so that by the next week I can create that presentation. With the MBSR, this will give me that what are the things that is triggering me. Like, for example, it could be a trigger that maybe next week I will be a failure. Next week, what to do this, I have a lot of work like this. So with the MBSR, when I understand that, okay, in the time of the stress I have a lot of the overthinking thoughts, I have these things. So at that point, using the mindfulness skills, using and accepting these things can help me out to reach my goal. And with the SFBT, it can prepare a proper intervention plan to the clients. So of course, combining both can foster the proactive problem solution with the emotional acceptance and making the change more sustainable and more permanent in the client's life. Okay, now the next thing, that is the Gisol therapy. So what it does, so it emphasizes the awareness of here and now experience, like shining a flashlight onto the current feeling. Okay, so it's like, we emphasizes on the awareness of here and now experience. Okay, it's like shining a flashlight onto our current feelings, that what are the feelings that we are feeling right now. But what MBSR does, it train you to stay present and observe your experience. Like, in Gisol therapy there is a very big technique, that is empty chair technique. And when we are using the empty chair technique, the client got the here and the now experience. It's like there is a flashlight insight onto their feelings and each and everything like that. It's like just coming out from their body. So in the MBSR we train them to stay in the present and observe that experience, so that they cannot feel that relapse in their body, they cannot feel that emotional, they cannot feel that emotional overwhelming and the catharsis. Because of that we are doing this thing. This can be also help them out in that. Like during a heated discussion, Jolt might encourage you to notice that what you are feeling in your body, and MBSR teaches you the pause, the observe these feelings and accept them without any judgment. Okay, so together they can help the client fully experience the present moment, accept their feeling and respond authentically, improving the self understanding. Okay, so this is what we do in the Jolt therapy. Next is the combining therapies. uh, until now, is it clear that how it is different from other psychotherapies and how you can combine it? Okay, so now integrating MBSR with these approaches can create a powerful and the holistic toolkit. So it will allow the client to challenge the unhelpful thoughts in the CBT while cultivating the deep awareness and the acceptance of the bodily sensations and the emotion. Also, this combination enhances the emotional regulation, reduce the stress and effectively and promote the lasting change in the client. So imagine healing as a tending a garden. So CBT pull out the weed, EFT nurture the flower, somatic therapy loosen the soil physically, MBSR provide the daily watering together. So they make a vibrant and the healthy garden. So in a lot of the therapy cases we have to use the eclectic approach, in which we will select the therapy according to the client's need. Okay, so it's like if we combine all of these therapy with the MBSR, it's like a proper holistic toolkit for them. This will empower them from all the dimension, like from their thoughts, from their behavior, from their emotional, so that they can lead towards the holistic wellness. Now integrating the MBSR into the daily life. So mindfulness practice doesn't stop at the formal meditation, it flourishes in the everyday activity. So mindfulness practice is not about just meditation. In this you don't just have to do the meditation, it's flourish in your day to day life activities. Like use the regular routine as the anchor for the mindfulness, like brushing teeth, waiting in the line, eating. So these are the normal routines in which you can incorporate the mindfulness techniques in your day to day life. Okay, next is the build the micro practice. It's like building the small practice that will help you out, like the brief moment to check in with breath or your body. Okay, it's like just giving your time to yourself. It could be for 2 minutes, 5 minutes, whatever you require, but you have to do it on the regular basis. Like for example, when we go to the gym, why it impacts our body? Because it's like a micro practice where we are giving some time to our body, where we are giving some time to our breath and our mental health, and also on our physical health. That's why after going to the gym and after working out for a good period of time, we can see that impact on our bodies. Okay, so this is how we have to build these micro practice. We can change it according to the client's need, that whatever they can like. Okay, also repetition and the gentle reminders help form the lasting habit. It's like doing it on the daily basis so that it can become your lasting habits. Like for example, Anna sets a daily reminder to pause and take the 3 mindful breaths before starting the work. So over the weeks, this uh, simple act ground her and reduce the overwhelm. So it's like she just use one micro habit, that is having the 3 mindful breath before starting any work. So this will help her to be more grounded, and this reduce the emotional overwhelm, the overwhelmness wali feeling in the client. So that's why she is leading a good life. So integrating the MBSR into the life create the resilience and calm that last beyond the meditation cushion. Okay, so it's like creating that resilience and the calm in your body and in your life that can last beyond the meditation cushion. Okay, next thing is the MBSR session structure. That what is the session structure, or in the when we are using the MBSR. So MBSR run for the 8 weeks with weekly group session lasting for 2 to 2.5 hours and a full day retreat. So it depends that how many clients and how long you want to take. So it can either go for the 2-hour session, 2.5-hour session, or even a full day treat, according to the client's need. So each session include a guided mindfulness practice, a practice. It could include the body scan and the mindful movement. Second is the group discussion to share the experience and learn the new idea. Next is teaching about the stress and the mindfulness concept. So participants also commit to the 40 to 60 minutes of the daily home practice. It's like in the starting you have to commit yourself for some time, and it could be for 45 to 60 minutes. You can commit it for that. Okay, now for example, week 2 might focus on the body scan, where you slowly notice the sensation from the head to toe, like checking the message your body in is sending you every day. So this could be an example in which you are doing the body scan meditation, in which you are checking each and every part from your from your head to the toe. So MBSR in an 8-week structured program, where each week focus on the specific theme and a skill. So week 1 represent the orientation and the awareness of the breath. In this we will do the introduction to the mindfulness and focus on the simple breath awareness to cultivate the present moment awareness. So in this we are introducing the mindfulness, we are psycho educating about them, and then we focus on just simple breathing techniques, because the clients are completely new for this. So that's why we have to make the moment so that they will be little bit more familiar towards it. So that's why we can do this. In this we will do the orientation and the awareness thing. Next is the body scan practice, in which we will learning to systematically notice the sensation across the body to increase the bodily awareness and promote the relaxation. So in this we will learn that how to notice the body sensation, how to understand the body sign. Like for example, if I am having a headache, then understanding this thing, if I have the tension in my whole body, then how to be more aware towards it, and then how to promote the relaxation. That okay, now I have scanned my body, then what are the small relaxation technique that I can incorporate in this week. Next is the mindfulness moment. In this, incorporating the gentle yoga stretching with the mindful attention to connect the movement and the breath. So in this, now we are incorporating some relaxation techniques, some stretching and the gentle yoga with the client, so that they can easily be more mindful and they can connect the movement and the breath of their body. This is how they will feel more relaxed, more calm, and now they are able to understand and their body is able to accept that thing. Next is dealing with the stress and the difficulties. It means exploring that how to recognize and accept the difficult emotion and the thoughts without a reaction. Like now we will teach them that how to deal with that stress, how to accept that difficult emotion, how to accept that difficult thought in themselves without having a reaction, because a lot of the client have hold a lot of the things. It's like they just emotionally withdraw themselves from a lot of things. So at that time, how to deal with them, how to process them. So this is what we will learn in the day 4, or with what we do in the day 4. Next is the mindful communication and the relationship. It's like developing the awareness in the interpersonal situation, practicing the deep listening and the compassion. It's like now when they understand themselves, when they are able to process their emotion, now they will develop the awareness of the interpersonal situations. It's like the people around them, if they have if in their society, with the in the social circle, now how they can do it, how to listen actively, how to show that compassion, develop that empathy. This is what we do in the mindful communication and the relationship. Next, week 6 is about the working with the thoughts and the emotion. It's like observing the thoughts and the emotional pattern without judgment or getting caught up. It's like when we understand this thing, when we are able to apply it, is now working with their thoughts and the emotion. Now how to work with them, how to observe them, how to make them a proper habit, okay, how to do that thing. So this is what we do in the week 6. Then the week 7, it means cultivating the patience and the trust. It's like building the patience with the self and the processes, trusting the mindfulness practice. It's like building that passion with the self and the processes. It's like creating and cultivating that patience and the trust with our own self, so that this can become a more indulged activity with us. Next, integrating the mindfulness into the daily life and the course closer. It's like planning the ongoing practice and reflection on the personal growth. It's like now in the 8 weeks, what are the things that they have learned. Now with the ongoing practice, we will do the reflection, and now we will make sure that they can easily adapt these things in their day to day life. Okay, so each week include the guided practice, group discussion, home assignment for the deepen learning. So this is what the MBSR structure look like. Again, week 1 is about the orientation and the awareness, week 2 is about the body scan, week 3 is about the mindful moment, week 4 is about dealing with the stress and the difficulty, week 5 is about the mindful communication and the relationship, week 6 is about working with the thoughts and the emotion, week 7 is about cultivating the patience and the trust, and week 8 is about integrating the mindfulness into the daily life and the course closer. So this is the all theory part related to the mindfulness based stress reduction. So is there any doubt, anything that is not cleared? Anyone, any questions, any doubts? Otherwise just give me a thumbs up if everything is clear. Okay, if everything is clear till now, then we can learn about the sorry, practical tools and the techniques. Okay, so now what are the some activities that we can use in the MBSR? So first is the mindful breathing with the personal rhythm exploration. So these are like, now we have understand the week structure. Now what are the activities that we can do in, give them to in that structure. Okay, so this is about that. So first, the theme of this activity is cultivating the awareness of the breath and discovering your personal natural breathing rhythm. That what is your breathing rhythm, awareness about yourself, about your breathing system, and each and everything like that. So this is the main theme of this activity. Goal and the benefit of this activity is this practice calm the nervous system, sharpen the focus, and helps to regulate the stress by anchoring the attention to the present moment through the breath awareness. Like because of the breath awareness, we can anchor in the present situation, that help us to regulate the stress, calm the nervous system, and stay focused towards our goal or towards the thing that we want. Okay, so this is the goal and the benefit of this activity. Next is the age group. So this activity is suitable for the adolescents and for the adults. It's like 12 years and above. If you are in your therapy session, you can even, just a second. Okay, so if you are doing this in the therapy session, you just have to think, you have to just observe that whether your client is 12 years and above. If yes, then you can use this activity even in your first session or second session with your client. Now the instruction for this activity is, in this you have to sit comfortably with your back straight and eyes closed or the softly focused. Then bring your attention to the natural flow of your breath without changing it. Next, notice the rhythm, the depth, and the pace of your inhalations and the exhalations. It's like you have to sit down comfortably. Either if you cannot sit down properly, then you can lie down on a place where you feel safe, where you feel comfortable. then you have to close your eyes, and then you have to bring all your focus towards your natural flow, okay, towards the breath you are taking in. Like, what is the rhythm of your breath? It's like you are breathe in and breathe out, or you hold it for few minutes, or you cannot hold it for like what, okay. So it's like understanding the rhythm, the depth, that are you able to do the deep breathing or not, okay. What is the pace, that are you did you take the breath on the slow level, or you are just taking it very fast. It's like this is something you can understand why the when the people speak, okay. Just take it as an example, that when they are speaking you can understand that what is their tone, okay. Whether they are speaking very fast, very low, okay. They are using very soft tone, very harsh tone, where they are very using the high paced or low paced voice. So this is what we observe in the voice. So in the same manner we will observe our breath, like what is the rhythm, the depth, the pace, that how we are breathe in and breathing out. Next, explore the gentle breath variations, such as lengthening the exhale or pausing briefly after the inhale. Find what it feels natural and calming. Okay, so it's like if I just ask you to do a deep breathe in and breathe out, so this is very normal to you. But if I ask you to do 4-7-8 breathing technique, in which we inhale for 4 seconds, hold for 7 seconds, and then exhale for 8 seconds, so this thing is very comfortable for few of you, and other few feel like that no, this is not something that we can do on the day to day basis. For them, 4-4-4-4 breathing is something, or the box breathing is something that is very comfortable. So at this point we have to do the breath variation. It's like inhaling for the long time, exhaling for the long time, then pausing for just few moments. So this is how we can understand that what is the rhythm and what is the natural breathing, and what are the things that my body like, okay. Like for example, for me, I cannot inhale and exhale, I cannot do the deep breath for a longer period of time. So at that point, doing the oceanic breathing means using my mouth to exhale with a sound. So this is something that is very relaxing to me. So for me, if you are a therapist, at that point you will use the oceanic breathing in my upcoming meditations or something like this, because this is something that I like, this is something that my body can accept, this is my natural breathing, this is the sensation of the breathing that I can feel, and I can literally be very comfortable with it. So this is how you will understand your client's breathing, their personal rhythm, and they will also understand, become more aware about their body, their emotions, and even about their breathing. Also, if your mind wanders, kindly bring it back to the sensation of the breathing. Like at that point when we have closed our eyes, at that time a lot of the memories, a lot of the thoughts just pop up in our mind. So at that point we have to focus in the present, okay. We have to tell a lot of time that okay, it's okay if your mind go anywhere else, or if some memory pop up, at that point just tell your mind to focus on the breath, we will talk about that later. So this is how, if in the sessions or in the between you will do like this, so that they can bring that sensation back to the breathing that they are feeling. So after doing this, you can have a discussion question with your clients, that how does your breath respond when you observe it mindfully. Okay, it's like what you can feel in your body, so that even if as a therapist you can also understand your client's nature, you can also understand their bodily reactions, and even in the next plans you can add the activities according to that. Next is the did exploring the different breathing rhythms change your sense of the calm or the focus. That if when you are exploring this, when you try the different variation of this thing, the different breathing rhythms, so can change your sense of the calm or the focus. Did it able to change the sense of the calm? It's like whether you are able to feel more calm, or what kind of the breathing you are feeling more calm, and what kind of the breathing that you are doing, at that point you were more focused about your breathing, you are able to focus on your body, instead of having a lot of the pop-up thoughts, a pop-up emotions, or a lot of pop-up pains. What are the things that you basically like? So these are the questions that you can, even if you are doing it in a group session, then you can make a worksheet out of it, and you can ask these three questions to your client to understand them in a better format. Also, can you notice any pattern in your natural breathing during the stressful moment? It's like, is there any breathing pattern that you use, or you can remind it, or is there any memory in your mind that will remind you of a stressful moment, and how or which type of the breathing pattern you are doing at that point? Maybe right now I am doing like Kapal Bharti. Okay, this is something, this is also a variation of the breath. This is something that I am doing, and this is something that I also notice in my stressful moment. So at that point, incorporating the Kapal Bharti, incorporating this kind of the breathing can even help me out to create that as a habit. So this is what you can easily understand about this thing. So is this activity clear? Any doubts? Any questions? Otherwise, just give me a thumbs up. Okay. Next is the body scan with the emotion mapping. So the theme of this activity is building the deep awareness of the bodily sensation connected with the emotional experiences. Goal and the benefit of this activity is enhance the mind body connection, encourage the relaxation, and help to identify the area that where the emotion manifests the physically. Okay, it's like creating that deep awareness about the body sensation, that what are the emotional experiences that I am facing. And also this activity will enhance the mind body connection, that what is the connection in between the mind and the body, and be in the more present moment. This will encourage the relaxation and help me to identify the area that where the emotion manifests the physical pain. Okay, this could be used on the teens and to the older adults. The instructions are simple, that lie down or sit comfortably, where whenever or in which situation that I feel very comfortable, I feel very relaxed, I have to do that thing. Either I can lie down, or either I can sit on the chair with my back straight. Okay, then slowly move your attention through the body, starting from the toes up to the head. It's like, now I will focus from my toe to the head. Okay, it's like in the body scan for the with the emotional mapping, you can ask the client to just imagine about a white ball, or to imagine a spark that is getting inside in their body from their toes, and that slowly moves toward their head. Like for example, that is in my toe, then my ankle, then my leg, then my thigh, then my buttocks area, then my stomach, then my back, and then slowly it moves towards my chest, the shoulder, the hands, now to the neck, now to the cheeks, to the mouth, then to the face, and then like to my ears, my eyes, and then to the head, and from the head it is going out. Okay, also if your client feel like very stressed at that moment, they are not able to do that thing, then you can just shorten this guided meditation, or you can just shorten it out by removing some steps. Like for example, from the toes, from the toes you can directly go to my leg, directly leg to the thighs, then to the stomach, to the chest, to the shoulder, to the hand. It's like covering the whole body part, so that instead of focusing on each body part, we are covering the group of the body part. It's like proper hand. If they have time, you can go like to the finger, to the palm, to the wrist, each and everything like that. So this is how you will increase and reduce the time duration of the meditation according to the client's need. So and this is how they will understand, and they will notice the warmth, tension, and the tingling without a judgment. Okay, it's like from the toe to head. Now when the spark is moving, can they feel any sensation, any color, or any blockages in their body? So this is how you will help them to scan their body from the toe to up. And when you notice a sensation, pause briefly and check any emotion or the memories arise in that area. It's like I can feel the tingling sensation in my stomach. So at that time, I will be there, I will stay there, for I will focus on that part for like 30 more seconds or 1 more minute. At that time, I will notice that is there any memories, or is there any emotion that I can observe in that area, is there any other color or anything that I can visualize or feel in that area. Like for example, I can feel like the butterflies in my stomach. So there is no real butterflies in my stomach. Butterflies, I like the metaphor. Butterflies, I like that represent the nervousness. So this is how you can help them, or your client will understand, or they will observe their whole body, and then allow the observation of the physical and the emotional sensation in the accepting way. It's like now, when after this meditation, when they will speak to you, now they are allowed to observe all these things without judging them, and in a way that they are accepting it. Like for example, I can feel the butterflies in my stomach. This means that okay, I am nervous, and I accepted that yes, I am nervous in a lot of the moment, and because of that I have these kind of the feelings. So this is how you will do the body scan and with the emotion mapping. Even if after doing this, you can give the pen and paper to the client, and you can ask them to draw the body outline, and where, in which body part, what are the things, or what are the sensations, what are the emotions that they can feel at that point, they can draw it out. Okay, so after doing this, what are the discussions questions that you can ask the client, that were you surprised by any emotion that is linked to the body area? That is there any emotion that you can feel in your body? Okay, anything that you can name in your body, anything that came into your mind, any memory that pop up in your mind that make you surprised? So this is how we are understanding the client in a fuller manner. Next, that how did acknowledging these connection affect your understanding of your feeling? Okay, that like now when you are acknowledging these connection, now when you are understanding these connection, these feelings, so how it is affecting you, that whether are you able to accept it, not accept it, are you more aware about yourself, are you more aware about your thoughts, or what? Maybe they can, or maybe they cannot, so this is completely optional to them, but at least what they want to say, they have to say like this. Okay, next is, can recognizing this help you in managing the stress or emotion? That now when you are aware about it, when you know about it, so are you able to manage your stress, or are you feeling more calm or more stress free because of this? Is there any other changes that you can acknowledge, any other changes that you can do? Okay, so these are the questions that you can even ask the clients. Next is the mindful movement and the movement variation. That if when we have to incorporate the mindful movement, and how we can variate that movements according to the client's need. So the theme of this activity is the gentle yoga or the stretching, practice with the full awareness of the movement, breath and the bodily sensation. It's like using the gentle yoga or the stretching practices to the client, that create that full awareness in their body, in their breath and in their bodily sensation. Now the goal and the benefit is to improve the body awareness, release the physical tension and support the flexibility and strengthen the mind body relationship. It's like improve the body awareness, so that they can become more aware about their body, release the physical tension if they have anything in their body. Next is the support the flexibility, so flexibility and strengthen the mind body connection, so that they can become more flexible, more supportive, and this can strengthen their mind body connection for their better mental and the physical health. Next, the age group is suitable for most ages and the fitness level. Modification are encouraged. Okay, so this is suitable for all the age groups and all the fitness level, but you have to do the modification according to the client's need. Like for example, if your client have any back injury, or if they have the pain of the cervical, so at that point you have to add the activities, or you have to create that modifications for them, so that this pain, or the if there is any pain in their body, then how it can be also, they can also do this thing. Like for example, if they have the cervical pain, if I am giving any exercises, at that point I can ask them to skip that part that is very hurtful. Or if I am giving them any yoga, so I will select that yoga that will not impact their back injury. So this is how you can modify it according to the client's need. Now the instruction is stand and sit in a comfortable position. You can either sit or stand, because it's like a general yoga or the stretching practice. This is a very common activity that you can also do in that. So this is what you can do with your clients. Next is the slowly perform the gentle movement or the stretching, coordinating the breath with the motion. It's like doing the yoga or doing any other practice or doing any kind of the movement from your body with the coordination with your breath. Okay, it's like if I am just raising my hand, so at that point I can inhale. When I am putting it down, I can exhale. Okay, so any movement like this you can add it, and this is how we will incorporate the gentle movement or the stretches with the breathing techniques. Next is the paying the attention to the sensation in the muscles and the joint you as you move. Now we have to focus with the breath. We will focus on our body, that if we are stretching any muscles or in the joint, what are the sensations I can feel, what are the, is there any tension that I can feel, is there anything else that pop up in my mind related to the emotions or everything like this. So this is how now I am paying the attention to my whole body. Next is experiment with the movement, speed and the range, noticing that how different variation affect your body and the mind. It's like now experimenting with the different movement speeds. It's like doing it on the count of 4 or doing it at the count of 3. You can variate the movement, you can variate the counting, you can variate the speed and the range, and then notice that how different variations affect your body and the mind. That is there any other changes that you can observe in your body, in your mind. So this is what you will do in this activity. Next, that if your mind wanders, gently guide it back to the moment and the breath. It's like if it is wandering, then you as a therapist will instruct that come back to the present moment and focus on your breath and the movement. So this is how you can create that awareness moment for them, create that mindful moment for them. They can be present in the present situation, and this is how it will help to release the physical tension, the physical pain, and improve the body awareness to your clients. After doing this activity, these are the discussion questions that you can ask, that how did focusing on the moment change your experience. Is there any changes that with the moment or focusing on this moment, how you are feeling, and how focusing on this changes your experience about anything. Okay, next is, did different movement speeds or the depth affect your feeling, that when you are changing the speeds, when you are changing the things, does it affect your feeling. Like for example, in the starting I am feeling very calm and very relaxed. After that, when the speeds up, at that point I am not able to cope it up. So at that point my body feel like very lethargic, it's feel like that I am a completely disappointment. So this is also an observation that I can feel. Okay, so you can ask this thing to your client. Next is, could regular mindful movement support managing the stress or the tension. Okay, it's like could regular mindful movement, like for example if I teach you a simple activity, so if you are doing this, does it help you to manage your stress or the tension in your day-to-day life level. So these are the question, or whatever we have learned today, is there something that will help you in your day-to-day life. So this is how you can understand that what are the insights that they are getting from the sessions. So this is what you can do in this activity. Next activity is mindful eating with the sensory exploration. It's like now how we can eat, and also with the sensory exploration means using our all five senses, how we can include that thing. It's the theme is engaging the senses fully while eating or the drinking to foster the, just a second. So it's like when it's like when we are eating or drinking, at that point how to be in the present moment, how to use our all five senses, like our eyes, our ears, the skin, the nose, and the tongue, how to use all the five senses while eating. And this is how we will create the mindful eating. Okay, so from the personal experience, this is the one activity that even I give to a lot of my clients. It's like almost to every of my client from their first session that they have to do the mindful eating, in which they have to include all their five senses. If they are eating their food, so for the one time they have to sit all alone and they have to incorporate all their five senses. And that's how this is a simple mindfulness activity, especially for those people who are very skeptical about the mindfulness. They don't want to incorporate it in their day to day life, who are very dicey, who don't want to do the homeworks, or who don't like the meditation. So this is like a very simple and the effective technique that even on my every client it helps. Okay, this is like a small activity that have incorporated uh, the proper mind body movement for themselves, a proper self time for themselves. So even you can also add this in your schedule, because this will help you out in all the manners. So the benefits and the goal of this activity is it will enhance the enjoyment of the food, improves the digestion, and reduce the overeating, and even cultivates the gratitude. Like if you are dealing with the client having the stress, anxiety, depression, even having the eating disorder, you can give this activity to them. So this will help them out. So this could be used with the all ages. In this, they what they have to do is they have to choose a small piece of the food or a simple drink or sip of a drink, and then before consuming, observe it, experience its texture, its smell, its taste, and then take a slow bite, sip by sip, or a slow bite, or bite by bite, a very small bite, focusing on the taste, mouth feel, and the aftertaste, and then chew or savor slowly, noticing the changes in the flavor and the sensation. Pause between the bites to be fully present with the experience. It's like when you have the food, now you have to tell yourself, you have to use your five senses, that what are the things that you can see on the plate, now what are the things that you can smell from your plate, now what is the texture, how when you are touching that food, how it is feeling. In this you will not use the spoon and the forks, you will use your hands. Okay, in this you are feeling the food, you are tasting it, that okay, now when you are eating it, what are the flavors it contain. Okay, is it very chewy, it's very savory, what do you think, what are the main ingredients in that thing. You have to tell yourself all of these things. When you are eating it, can you hear any sound, can you hear your chewing sound. So you are including all the five senses to be in the presence, to enjoy that food with the fullest thing. Okay, so this is what you will do in this activity. Even if before, you will observe the before and the after taste. It's like sometime we also say that okay, when we are eating this, it contain a aftertaste, we can feel that thing. So you have to observe it for your each bite. Okay, so this can create a proper moment to you. Okay, so now after doing this, the discussion question could be that how did slowing down affects your experience of eating and drinking. Okay, now when you have slowed down your food intake time, then at that point, what are your experience. Just remember, if the client is doing them this, now you also have to give them a clear instruction that they will put their all focus to the food. It's like no one will be there. Second thing, they will not use the food, they will not use the phone during this time. So this is the instruction that you have to give, especially to the child and the adolescent, that is really required. Then, did you notice the taste or the texture you usually miss? That is there any taste, is there any texture that you can feel or you can observe in the food or in the drink that you really miss, or anything that is connected to your childhood or something like that. So this is also a discussion question that you can ask to your client. Next is, how might this practice impact your relationship with your food. That when you are having this type of a relationship with your food, when you are doing this way, how do you think that this can impact your relationship with your food. It's like, are you enjoying it, not enjoying it, what. Okay, so every client has their right to say anything. Now as a therapist, you will observe it and understand it. Okay, so this is what we will do. So this is all about the activities that is completed in this session. Any doubts, any questions in this, anyone? Just give me a thumbs up if everything is clear till now. Okay, so although we are short on time, so that's why I am just discussing the case. I am not giving you the proper time to think about it. Okay, so interactive case discussion. So this is the case. So meet Rajesh. He is a 40-year-old software engineer who is juggling a demanding job, family responsibility and the chronic anxiety. And recently Rajesh has felt the overwhelmed by the racing thoughts, the difficulty in the sleeping and the physical tension causing the headaches and the tight shoulder. So this is the case of a Rajesh who is facing all of these issues, and he want to regain the calm and the focus, regain the calm and the focus, but struggle with the busy schedule and the tendency to react quickly to the stress. So he want to regain that calmness, he want to regain that focus, but he is struggling with that. Okay, so by using the MBSR, Rajesh aimed to improve his mental clarity, reduce the stress related symptoms and build the calm resilience in the daily life. So this is what Rajesh is looking from the MBSR. So now you have to think about these questions. First is, which MBSR technique would be most helpful for Rajesh? Second, how can Rajesh fit MBSR practice in his busy daily routine? Next is, what challenges might Rajesh face in maintaining the mindfulness practice? Next, how can a therapist support the Rajesh to overcome these challenges? Next, that how could practicing MBSR change the Rajesh response to the stress over time? So, the answers of these questions, although if you want you can answer, you have 1 minute. If anyone wants to answer this question they can, otherwise I will just tell the answers. It's not a big deal. Anything that you understand from this workshop and you want to answer any of these questions? Okay, so it's fine. So, the answers for all the questions are that techniques such as the mindful breathing to anchor the attention during the anxiety. You can use the mindful breathing, you can use the body scan for the awareness and the tension. You can use the mindful moment to release the physical stress, and mini meditation for the quick resets during the day during the day would benefit the Rajesh the most. So, you can use all of these things. Next is starting with the short 5-minute mindful breathing session before walk, mindful session break at the lunch, and the body scan before the bed can help the Rajesh to gradually incorporate the mindfulness without overwhelming his schedule. So in the daytime he can start with a 5-minute mindfulness breathing sessions, like before walk he can do this thing, a mindful stretching during the lunch breaks, and even if when he is in the office he is sitting to the laptop for more than 2 hours, he will stand up and do small mindful stretchings. Okay, so this will help him out. Also doing the body scan meditation before he sleep, or before or at the end of the day, this can also help them out to understand and to incorporate the MBSR, to incorporate the mindfulness in his day to day life schedule. Next is, Rajesh may face challenges such as lack of the time, impatience with the early result, or distraction during the practice. So these are the challenges that the Rajesh may face. That lack of the time, he may say that I don't have any time for this, I cannot make a time for this is very hard for me. He can become impatient for the early result, like after doing it for 2 to 3 days he might say that I cannot see any result, I cannot focus on these things, I cannot focus on my body. So he can become impatient, and this is why he can be distracted during the practice. Also he can be distracted, like when he have a lot of thoughts in the body, in the mind, at that point he is not able to focus on the breath in the starting time. So at that time these are the challenges that he will face. Next is A therapist can encourage the gentle acceptance of the progress, help set the realistic practice goal, that setting the goals that are realistic, that are practical, and that can be done by the client. Like for example, in this case, when he is going to the office, he is a software engineer, he is on the screen. So at that point I cannot cut down the screen time to this client. I cannot ask him to just do the stretchings in the while he is doing any projects or anything like that. I have to understand his schedule, I have to accept all of these things, then I have to create that practical goals that he can easily do, then provide the emotional support and suggest the shorter or the modified practice when needed. It's like if he is not able to do the full meditation like for 5 minutes to 10 minutes, so at the time shorter the time, okay, so that he can do that thing in the day to day life, and that can become a habit to him. Also, that over the time Rajesh may observe the stress signals earlier and respond with the calm response. Like when the question was that how could practicing MBSR change the Rajesh response. So with the time when he is able to do these things, then he can observe the stress signals, that what are the stress signals, what are the things that is triggering to me, what are the responses that my body is doing. Now he will be become more aware about all of these things, he can become more calm rather than the impulsive reaction. He can select that how to respond in the particular situation. Also reducing the physical symptoms could be like headaches, body pains, or anything like this could be reduced, and this will also improve the sleep and the focus of the client. So this is all about the today's workshop. So what exactly we have learned today? So today we have learned that mindfulness is about the present moment awareness without judgment, helping us to respond to the stress with the calmness and instead of the reactivity. It's like be in the present moment and without judging ourselves, how to respond the stress in a calm and the impactful manner. Next is the MBSR is a proper structured and the evidence based program that cultivates the lasting resilience by training the attention to the body, breath, and the mind. It's like giving that attention, giving all of these things to the mind, so that our body, our mind, our thoughts can become more resilient. It can become more calm over the period of a time. Next is mindful eating is a practical, accessible way to bring the mindfulness into the daily life, deepening the enjoyment, fostering the healthier relationship with the food and ourselves. So mindful eating is a very practical, easy to do activity that can bring the mindfulness in our day to day life, which can deepen the enjoyment level, which can create a relationship of our body with the food and also help us to heal. Okay, then integrating the mindfulness into the routine moments can create the lasting change, not just during the formal meditation but through the everyday mindfulness awareness. So in this, when we are being aware, when we are mindful, so at the time integrating this in our day to day life can create a long lasting change in our habits, in our body. Okay, next, combining the mindfulness with the therapeutic approach enhance the emotional balance, self awareness, and the stress management skills. So when we are combining this with the therapeutic approaches, this will enhance the emotional balance. Like if we are combining it with the other psychotherapies like CBT, DBT, SFBT, somatic, or anything else, so at that point it will enhance the emotional balance, the self awareness will be created, and even the stress management skills can be created in the client, that can give him a proper holistic and the holistic wellness, and he can lead towards a life that he want. Okay, with a proper peace, a proper calm, where he is being resilient, he know that what I have to do and how to respond in this particular situation. So thank you for your openness and the curiosity, and may the seeds of mindfulness planted today continue to grow, nurturing the peace and the clarity in your life. So I thanking you all that you are being here, you listened me for more than 1.5 hours. So I hope this is very helpful to you, you understand this. Now the small things about the MBSR is in your mind, and this is how you can also incorporate this in your day to day life before giving it to someone else. So the last thing, do you have any questions, anything that you want to say? even if how you like the workshop, like it, not like it, anything that I have to change or improve in the upcoming workshops. Okay. So thank you all for this. For the people who have paid for the resources and the certificates, they will get the certificate and the resources by tomorrow. And even in the resources session, I have added the proper MBSR workbooks that you can directly use on your clients. If you have booked for it, then completely fine. If not, if you want to enroll, then you can also contact me on the WhatsApp, and then you can just book your then you can also book for the resources and the certificate. So this is all about today. Thank you everyone for being here, and I hope for a happy Diwali, although we have a next workshop next week, but due to the Diwali we are postponing it. So thank you so much. I hope to see the similar faces in the upcoming sessions. Thank you everyone.